Hello, everyone. Welcome to The Reason We Learn. I'm your host, Deb Philman. At The Reason We Learn, we aspire to be part of the solution. The purpose of this show is to take a good, honest, potentially painful look at the way kids are being educated. We know we can do better, and this is where we'll talk about how. Let's learn something. Hello, everyone. Welcome to The Reason We Learn. I'm so happy you're here. If you are new to this channel and interested in being part of the solution to our education crisis, I hope you'll subscribe to be notified when I make new content. Please also like and share this broadcast so others can benefit from the information we're about to share. Each of these shows is an opportunity to talk to somebody who is working on either making education directly better or helping educate us about how our children are being educated and guided and counseled and so forth along the way to adulthood. And today's is no exception. Camille Kiefel is a pathfinder. She brings the message that mental and physical health are connected in an area of medicine dominated by medical institutions and their bottom line. Instead of pursuing risky experimental and life-altering treatments for gender dysphoria, she advocates for a medical protocol grounded in the physical fundamentals of health. A detransitioner herself, Camille once believed a non-binary double mastectomy would finally provide relief, where 20 years of talk therapy with conventional modalities hadn't. She lives with physical health issues from the surgery. Through improved diet and directly addressing her physical health imbalances, her mental health resolved. She now brings awareness to the often overlooked but undeniable link between physical health and mental health. And this does apply to our children as well. You might be thinking, oh, this is an adult issue. No, this applies to children. Camille determined that the discomforts that led to her gender dysphoria were rooted in the state of her physical health all along. And they had been overlooked by her doctor, 2 mental health professionals, and a surgeon. Camille lives at the intersection of foundational controversy and how we deal with health, how we define health. That mental health is not separated from the biological systems of the body, and she believes every human being needs a solid foundation in physical health from which to thrive, an integrated approach to health that incorporates all 3 foundational domains of health: physical, mental, dietary. They're needed to address the biggest health issues of our time. And so I've invited her here to talk to us specifically about detransitioning. What is it we don't know? We talk so much about what's going on in our schools with kids being transitioned, either socially at first with pronouns and the way they dress and how they're treated at school, to puberty blockers, to cross-sex hormones, and then ultimately to surgeries. But we rarely talk about what the process is if someone changes their mind and what else is overlooked other than the argument that it's sort of a religious cult-like thing that kids are being inducted into. We don't talk about the reasons they might be seeking something like this. And so Camille's going to talk to us about the potential health reasons they might be looking for that, and also tell us what the process is of detransitioning, what we don't know about that, what we need to know about that, especially when we're talking about things like informed consent. And I'm really grateful to her for spending this time with us. So please join me in welcoming to the studio, Camille Kiefel.
Hey,
Hi there.
Hi, thank you for having me.
I'm so glad you're here because, as I said to you before the show, this is an area I know nothing about. I've read extensively about the process that kids go through getting kind of pulled into the medical side of gender theory and transitioning, whatever you want to call it. And I've heard some of the really tragic stories from detransitioners about what happened to them before they detransitioned, but only little bits and pieces of what they've gone through since. And I know less than nothing about the health connection. So thank you for joining us and teaching us about this.
Yeah, thank you. Thank you for having me because it is important to discuss the health side of things like after you transition and then you figure out like this was not a good fit for me. And then when you detransition, what that healthcare looks like, because currently there's no ICD-10 code. So for those of you who aren't familiar, ICD-10 codes are medical codes that is used for insurance billing purposes. And so when you don't have an ICD-10 code like we don't with detransition, it can be very difficult to get medical care. And we have seen detransitioners either not able to get medical care because there's no ICD-10 code, or it's been very difficult because sometimes doctors have to find a workaround, and that could be medical fraud. So it is very difficult to get medical care as a detransitioner.
Right. And I definitely want to hear all about that. But if you could, before we get started, if you could just give us a real quick overview of your personal story and how you, how you came to this point in life and then what made you want to detransition.
Yeah. So what got me to this point was that in sixth grade, I was dealing with trauma. And then when I was in college, I was introduced to the idea that I could be non binary. And I was just dealing with trauma for years and I wasn't getting better. And I wanted to opt out of gender. I also just felt different. And so that was very appealing to me. So in 2016, I saw a gender therapist. The therapist affirmed my non binary identity. And then I went and after struggling with mental health for years and not seeing improvement, did 2 rounds of transcranial magnetic stimulation therapy, which is a treatment resistant depression. I also was doing DBT, which is dialectical behavior therapy. I was not responding to that. Did EMDR, which is a treatment for PTSD in general. Just I wasn't responding well to medications, and I just needed more help. And so I had discomfort with my breasts, and I reached out to my doctor. He connected me with somebody who then connected me with two mental health professionals who signed off on a non binary top surgery or mastectomy, one that does not exist in nature. And then on August 27th, 2020, they performed the surgery. And then after that, I developed health complications after the surgery. And my doctors took me seriously at first, like many detransitioners. They did not take me seriously after a while. So this is something we are seeing with detransition is that before the surgery, detransitioners are treated well. After the surgery, especially if they're open about detransition, that care becomes more difficult to get. So I did not detransition at that time, though. For me, it was that I was just struggling with a lot of mental health issues and physical health issues, and my doctors thought my issues were somatic. And once they thought that, their attitude towards me changed. And so um, at that point, they told me to go see a therapist, and I had known I'd done so much therapy that wasn't the answer. And so at that point, I started to address my physical health. I reached out to a naturopath to try and deal with these physical symptoms.
Mhm.
And I was shocked that once I started adding meat back into my diet again, after doing manual therapy and all these other physical health treatments, that I was shocked when my mental health got better because this is something I was told you're going to have to live with for the rest of your life. You're just going to have to manage it. And then here I am, like, still dealing with the physical health issues, but my mental health's like the best it's ever been. Like I was successfully able to get past my generalized anxiety disorder. I still struggle with ADHD. It's very mild. I no longer
Mhm.
have major depressive disorder. I no longer have CPTSD. So
And
I've
this
been
is all
able.
from adding meat back into your diet, or were there other changes?
There were other changes.
Okay.
So the meat was huge. The meat was huge for me. So adding meat back into my diet did help me significantly. And I know, like, I was a pescatarian before, so the only form of meat I was getting was fish in my diet, and then I wasn't getting enough of it. And it wasn't like I was eating terribly, like, I wasn't eating Cocoa Puffs for breakfast or anything, but, it's just I think that some people need to be on stricter diets,
Mhm.
including myself. Um, so Yeah, I was, adding meat did help significantly, and I do
So
feel a lot
when
better.
you first presented, I'm sorry to interrupt you, but when you first presented in the very beginning before transitioning to doctors with your even with the trauma symptoms, um, at no time did anybody do blood work to check things like vitamin D, vitamin B12, cortisol, hormones, thyroid, like metabolic issues that could be tied back to your diet. Nobody thought maybe there's something and she's as depressed or having these mental health issues because of something, or did they look?
I know they didn't look at my CRP levels. So they did not look at my CRP levels.
Can you explain what CRP levels are for those
So
who?
CRP levels are C-reactive protein. It's inflammation.
Mhm.
We found that I had high CRP only after the surgery. Nobody had ever run that test for me before. I mean, I wasn't checked for autoimmunity, and don't, I don't honestly know because back then I wasn't really aware of like what panels they were running for me.
Mhm.
I know I had high DHEA. I believe that's the correct one, which is
Well,
I believe
that's
it
the
was the,
hormone manager.
yeah,
That DHEA manages all your other hormones. So if it's high, it can misalign, it can like mess up. Everything has to be in balance. Some people don't understand that. You have men and women have all the hormones. Like men have estrogen, we have testosterone. But they get as far as how we metabolize them, we need DHEA to metabolize them. But if you have too much, that could make it seem low, or you could have, and then you might have had low testosterone, which can cause depression, or you could have had high estrogen, or you could have had just an imbalance in the 2 that causes. I mean, I'm not a doctor, but I'm just saying, like,
yeah.
I'm with you on if they don't first look and there's things missing from your diet, it can cause problems. So I'm sorry to derail it. So you to your knowledge, you're not really sure, and then later you added meat way after the fact, and things got better from that and other changes, is what I'm hearing you say. Is that correct?
Yeah, so it was like
Okay.
adding meat. It was like, I mean, I did hyperbaric oxygen therapy, which really helped. But yeah, kind of going back to the labs, because I know that the DHEA, like it was kind of weird because they knew it was an issue, or I think the naturopath was the one who like found it, or it's kind of weird because doctors would kind of find things like I don't know why that wasn't followed up because a gynecologist I think originally found it, and then I talked to a naturopath and she knew it was an issue, but like the first naturopath I saw wasn't very good, and she was just sort of like, well, here's some lavender tablets. So um yeah, that wasn't she wasn't helpful in that, but it's confusing because they weren't checking. All they were checking was the DHEA. Like they weren't checking. Well, now that I think about it, but the DHEA should have been. It's hard because like the issue with these labs is that they're not. We don't really know what labs connect to detransition either. Like we
Mhm,
don't even
mhm.
know like with transition. Like we don't have like a blood test that we can run to see who's going to transition and who's going to
Right, right.
be like this is a good fit for them. Like we don't have either. And so that's and then nobody was really resolving the DHEA, and I'm not quite sure how you'd resolve that. Like I think it should be fine now
Mhm.
because I know I've had it done since, so it would be fine now. But
It seems like the
yeah.
takeaway, though, from for the audience, what I'm trying to get across in asking these questions is to illustrate the point that our bodies are, regardless of our chromosomes, the way we feel. Okay, so the way we feel under in our own skin is a function of so many different things working in unison that have to work well in unison and can be thrown off by a variety of different things. Simply not sleeping enough can throw off your hormone levels. If you eat too much sugar, we know that can throw it off. If you're under a lot of stress, your cortisol can spike. If you have maybe a hereditary thyroid problem, or possibly your diet is causing a thyroid problem, there are all kinds of things that cause your hormones to get even a little bit too much out of whack, and that will affect how you feel. Like, in other words, are you depressed? Are you a little manic? Are you sleeping all the time, really tired? Moods, memory. And people have a tendency to go straight to some kind of mechanical treatment, or or even to therapy. Like, we've been taught for so long, if I feel lousy and I'm so kind of down and I'm sad, and especially in your case, if you've had a history of trauma, doctors like, it's almost 90%, they're going to go straight to it's in your head. Like, not it's in your head, but it's your trauma talking. It's somatic. The body's responding to the psychological factor, as opposed to the psychological factors responding to the body. So they tend to go in only one direction and not the other. And I'm going to say something that might make me unpopular. I think it's a little more common with women, meaning I think doctors respond to us differently when we say we feel lousy, that they go straight to here and not to the blood work, or not to the diet, or not to something else. And I think it's such an entrenched habit that we get sent to therapy, and then worse, they'll be like, here, take psychoactive drugs to get you quickly feeling better, that kind of thing. And nobody stops to go, all right, let's look at what you're eating. Let's look at your sleep. Let's look at, like, all the things that need to work pretty well for a regular person with no trauma to feel good. Now you add trauma on top of that, and it's like burdening yourself even more. So I just wanted to pass that along, like, to the people listening or watching, because everything else I think you're about to tell us is going to make a lot more sense when people understand why this matters. Like, it does matter a lot. Chemicals matter.
Right. Yeah, what you put in your body really matters, and there's so much weird filler in anymore. Like, I'm just, like, shocked when I actually look at ingredients because there's so much in there. I was looking at butter, like Tillamook butter, and it has, like, natural flavors in it, and I'm like, "Why would you need flavors in butter?" Like, butter is just amazing as it is. So,
Right. Exactly.
it's odd. It's like, all these, like, little things like food coloring and everything else. It's just they're adding it to food, and then some of us do not respond well to that. Um, and even at that, it's just probably something extra that you have to filter out. So it's yeah, it is really concerning. And then it's just doctors. I think the issue too is doctors, conventional doctors, I should say, don't know how to treat these cases. And I do think that women in particular have more issues with issues like autoimmunity and
Yes,
chronic
that's a
health
fact.
issues.
Mhm.
And so doctors in particular, conventional ones, aren't trained to treat those issues, except for if unless you are able to give them a medication and then they know what to do. But I remember I was struggling with PMDD. So, like, before my period, I would just like I was struggling with suicidal ideation, depression, and talked to I was seeing a new gynecologist because my current gynecologist wasn't available at that time, and I was like, okay, what can I do? And she's like, well, we can give you the pill, and we can just look at a different version of it, and we can give you that. And I said, okay, well, what can I do naturally? And
Right,
she
right.
just looked at me like a deer in the headlights. Like, she didn't know what to do. Like, that's not how they're trained to think. They're trained to just give you a medication. So um, it really concerns me. Like, kind of branching off into the detransition, we had I'm president of Detrans Help, which is a nonprofit by detransitioners for detransitioners, and we had a young man who reached out to us, and he's considering transition, and he's concerned to even reach out to us because he thinks we might be bigoted. So that was a red flag for me. I was just like, well, why? That's concerning that we can't even get people to question transition, because if we do, then they're considered bigoted. So that's an issue, first off. And then I'm just listening to him, and he's talking about how he wants to opt out of gender. He doesn't like sex, and he's depressed. And for me, I'm just listening to him. I'm like, this does not seem like somebody who's trans at all. Like, it's not like, I know I'm a woman. I've known I'm a woman since I was, you know, 5 years old, or, just when I was a child, I was doing this, and this is how I know. It wasn't anything like that. It's, I want to opt out of gender, and I want nothing to do with sex. And, like, we ended up talking to him, and he was concerned. Like, he was thinking about it, and he's like, well, I'm worried that this is going to cause more issues then it's going to resolve. And so he was actually concerned about it, and he had his reservations. And so I'm glad he did reach out, because we did talk to him. He was struggling with suicidal ideation, but it wasn't serious. So, but we did recommend the suicide hotline for him. We talked to him about therapy. And the other thing we talked to him about was, are you seeing a doctor? Um, because, check out your physical health, check out, things like a low thyroid can be an issue.
Mhm.
Autoimmunity can be an issue when it comes to depression. Even something like low testosterone, which generational wise, we're seeing in men, the testosterone levels are dropping for men, generational wise. So checking out something like low testosterone can cause depression. So these things aren't being checked out, because like when he was telling us about this, he's like, yeah, somebody recommended transition to me.
Mhm.
And he just wasn't sure about it. But it's concerning to me that they're recommending transition to somebody who's depressed and wants to opt out of gender before looking at all these other potential health issues that he might be struggling with.
Right. Yeah, they're taking, they're going about it, it seems, consistently as if it's always a psychological problem. And as I said, I genuinely think that's consistent with what is offered right now by medicine in general to people who present with any kind of a, mental health symptom. Is we're going to medicalize this. So either it's an SSRI, or in the case of somebody who says, I don't like sex, or I don't want I have this depression, or I don't want to be whatever, yeah, whatever the feeling is that they're having, like you said, it's not even really gender dysphoria. They're giving the symptoms of depression, and it's almost like they're getting steered towards gender medicine as opposed to even regular medicine. Just gonna bypass that and go straight to conversations about transition. And that's very concerning, especially when I think about younger and younger people. It's one thing when it's an adult, but now imagine the person is 13, right? So that's where they're even more suggestible. This is what the problem is, and so on. And then also, you're going to get validated with celebration and bling if you go this way versus change your diet. Um, that's very concerning. So you changed your diet and you changed some things around and changed some habits and you felt better. And how did that make you feel as far as looking back on the changes you made? And then, I mean, did you wonder, like, what if I'd done this sooner kind of thing?
Yeah, I wish that somebody had, because I remember right after the surgery, I was reading this article and it was connecting depression and diet, and I just remember reading it and being like, this is weird. Like, what do you mean you can you can
Yeah.
improve your mental health through diet? Like, that was just a bizarre concept to me. And the thing is that doctors would ask me about my diet, and I thought I was eating okay, because the thing was I wasn't, like I said, I wasn't eating Cocoa Puffs for breakfast and drinking a soda. And I thought, I was like, oh, well, I eat pretty healthy. Like, a lot of the stuff was like, like, I wasn't eating a whole lot of processed food, so that's why I was thinking at that
Mhm.
time that it was okay. And then
Mm.
after seeing Michaela Peterson, I saw how mentally stable she was on her carnivore diet, and I was like, okay, I read this article on depression, and she seems really stable. I'm going to try adding meat back into my diet, because at that point I was just desperate, um, to get better. And yeah, I was just like, it really did help. And then it was also things like, manual therapy, and then hyperbaric oxygen therapy that also got me in a more stable place as well. So,
Mhm. Yeah, it's amazing. There is such a strong connection between just, our habits, what we eat, sleep, etc. And I think people don't necessarily appreciate how dramatic the differences are in just a single generation between, like when I grew up and what we would eat in a typical day, not to mention how much sleep we would get and how much water we would drink, all the things. compared to today. I see a lot of young people drinking these monster drinks with high quantities of caffeine. Now, I'm a coffee drinker, so I'm not one to talk, but the caffeine they put in those, plus some of the other chemical stimulants, we know that over consuming these cause all kinds of problems, from heart arrhythmia all the way to such a low growth hormone level. Growth hormone also helps with energy and things, that you can get depressed, like just from that kind of too much caffeine. Then you add in, and the growth hormone, of course, affects cortisol too. And now we don't sleep because of blue light. It's I'm bad too. The phone's right there. And if can't fall asleep right away, start looking at it. There's the blue light. Blue light too late in the day will also keep you up if you work at a computer. We didn't have blue light. We didn't have that. It just like didn't exist. So I think there are a lot of new psychological symptoms that might be the function of body systems not having evolved. Remember, we're on the evolutionary scale, as far as we've come, our technology is way ahead of us, of our bodies. And that we take for granted that the human body can just adjust to getting, 6 hours of sleep and blue light all day and no fresh air, sitting in a chair. There's like all the things that we take for granted that actually can cause a lot of problems. Right.
Yeah, it's concerning. It's like I remember there's a study called it's about Pottinger's cats. And so these cats were fed a cooked meat diet,
Mhm.
and then by accident, like they're from my understanding, they actually got lazy in the study. They actually just started feeding some of these cats raw meat. What they found out by accident is that the cats that were eating the raw meat ended up being healthier than the cats that started eating the cooked meat. So the cats eating the cooked meat, um, down generation wise, they started developing brittle bones, um, unstable mood, um, and face deformities. And then by the fourth generation, they either had no interest in reproducing or would only produce stillborns.
Wow.
The cats that were eating the raw meat, healthy, good fur, no deformities, good mood, and would keep reproducing. So, and it really worries me. Like I'm looking at the lower testosterone levels generational wise. I'm looking at the dropping birth rates. I'm wondering if there is any possibility that diet could be impacting this. And diet's one of the last things that I feel like the conventional medicine model is really taking seriously. Like, I was just watching a video yesterday on these conventional medicine doctors, and they're kind of like, well, keto might help some people, but you're starving yourself. And, they're just, they it's like it's concerning to me that we have all this medicine and yet we can't actually figure out what a good diet or an optimal diet is. And even there is like this ideological bent towards veganism, which concerns me as well, because when you look at meat, there are nutrients in meat that are more absorbable in the body than in plants. So you're getting more of those nutrients out of meat. Um, and sometimes you're not able to get any of those nutrients out of plants. Like you have to eat meat to get those nutrients.
B12.
So it's concerning that they're pushing this vegan diet, and yet we know about like heme and non-heme iron and all that, and they keep pushing the vegan thing. And I get like, no, we don't want to hurt animals, but animals are hurt in the process of harvesting plants. Like this, it's not like it's not without animal sacrifice, anyways. So it's just like it's the whole veganism thing concerns me because it's like an ideological push in the medical field rather than trying to look at it objectively. Because we have seen people go on carnivore and their skin issues improve, their mental health issues go away, like depression and such. Like Michaela Pearson, she no longer has arthritis when she sticks to that strict diet,
Mhm.
which is just, I think that she just like eats like meat and salt. Like I think that that's it, like for her lion diet. So,
Yeah, my arthritis completely disappeared. I had it so bad. I thought I felt 10 years older than I actually am. And going on what's called a modified keto diet, so I don't it's more designed around women and so forth. But doing that protocol, um, it's gone. Literally gone. Like I don't have the arthritis that I had before. And I wasn't taking medication for it, but it's just gone. And my memory improved. I had terrible brain fog with having COVID. I got brain fog, and then it just wouldn't go away. So I'm myself, I've experienced the difference that changing your diet can make. And thinking back on even just spending my 20s being B12 deficient and not knowing it, I literally have pernicious anemia. Like, I cannot absorb it from my food. I have an autoimmune condition that I didn't know. And every time I went to the doctor, I told you this when we talked before the show, they would say, go for therapy. Go for therapy. Then ultimately it was, here's some SSRIs and all this. And none of it made me feel better until finally, and it took having my daughter. And then, you're going to the doctor all the time and they're taking blood and they're doing all these things. Finally, it was identified. Because my daughter was nursing and failing, she was thriving and then she failed to thrive. Your body stores a certain amount. And they said, you're very sick. And as a consequence, your daughter's very sick. They gave us both massive doses of B12 and she was better before I was. And then they said, for the rest of your life, you're going to need to supplement because you have this autoimmune condition. You have to eat meat, first of all, and you have to take extra because your body doesn't absorb it enough from the meat. So you can imagine if I were vegan. That's the first question they asked me, "Are you a vegan?" And I said, "No." In fact, steak was the first thing I ate after I gave birth, And they said, "Well, that's good. You need to keep eating it because your body just does not pull it." And then there's another factor that people aren't aware of, and it's called methylation. Did you learn about methylation at all? So
So one of my
supplements don't
naturopaths
cut
spoke
it.
to me about it, but
Yeah,
I can't quite remember because I think that they thought, you know what, I don't think I have that issue, but they were
yeah.
kind of questioning that for a little while.
It's another one people aren't may not be aware of, and doctors barely know about it, but they'll say, "Okay, go take a vitamin," and not all vitamins are created equal. So, I think what it comes down to, what I'm hearing you say is, and I can relate to, is that you have to advocate for yourself, and you have to really remember that your body is a whole body.
Mhm.
There are all these systems that are working in concert, and when you have a set of symptoms in one sort of locale or one area, what modern medicine tends to do is look at just that instead of looking at how the systems interact. Now, there are people who practice, as you talked about, integrated medicine or systems based medicine or whatever. But it sounds to me like in the field of gender dysphoria, this has not come up.
Yeah, and part of the problem is that, like, I remember reading Whipping Girl, which is a book written by a trans woman, like, years back when I was, like, deep in the ideology in college, and there's this idea that you can have trauma and be trans, and so because of that, they don't actually really investigate the trauma because it would be considered transphobic, um, and there's also this kind of idea of, like, I imagine taking away somebody's agency by saying, "Oh, you can't have this," procedure. Like, there's this kind of weird thing going on because they're what I'm seeing too, especially like with they're trying to introduce the detransitioner Bill of Rights,
Right.
and the thing is that there's pushback from trans individuals because they're like, well, we have them, we care about detransitioners, like they're part of our, we care for them and they're part of gender affirming care, which we know, especially as somebody who's experienced it myself, this isn't
Right.
true.
Right.
Many
Right.
of them don't care about us and we are not covered under gender affirming care. um, I was looking into reconstruction surgery, and one of the first things a doctor, or well, I guess the receptionist said to me was, well, you're a cisgender woman, so we don't think we can cover this. And so after that, they were like, well, let me talk to my manager. And so the manager gave the okay, but they're like, well, we need to figure out, first off, they were like, well, we need you to get a letter from a therapist, and then we're going to see if the insurance will even cover it. So we're not even out of the woods yet. Like, we're kind of in this weird place of like, well, you need the letter first, and then we'll see if insurance covers it under gender affirming care, which is an issue because then they're going to bill it under gender affirming care, and I'm going to show up as a statistic for another gender affirming care treatment. Like, it's not going to show up as a detransition treatment under the billing code.
So when people are doing research to find out how successful these treatments are or if they're even warranted, it won't even show up as X percentage of people desist or detransition because it's all covered. It would all be covered under detransition care. The other thing I'm noticing when you're speaking is they're asking for a lot of validation where it sounds like when you went in initially, they signed off on your mastectomy pretty quickly.
Yeah, I mean, they signed off on it right away. They're also using the correct terminology and language for me. Um, and they're a lot more sensitive. Like when you're a detransitioner, people are not going to be as sensitive to your needs. They're going to be a little bit more callous. Um, I mean, some people are going to be okay, but like that woman I was telling you about, like her response was like, "Well, we don't think you'd be covered because you're a cisgender woman." I mean, that's just sort of
Dismissive, if nothing else.
it's dismissive. It doesn't acknowledge the trauma I've been through or how difficult the detransition process was. There's just there's not a lot of knowledge around that. So um yeah, and it makes it really difficult because like there's this pushback against getting detransitioners care. Like I testified against Oregon House Bill 2002. Um, but one of the addendum that was done by Ed Deal in Oregon was that okay, if you're going to cover gender affirming care, then like for this addendum, like let's have a board of detransitioners, a medical board. Let's extend the statute of limitations, and then let's provide medical care for detransitioners. The addendum was shot down without any discussion. Like nobody said, okay, well, I'm okay with covering care for detransitioners, but I'm not okay with these other things. Like none of that was discussed. The
Like, they
addendum
just
was
shut
shot
it down,
down.
like, "We can't have this conversation."
Yeah.
Do you think that was because of the political nature of it all, or did they just genuinely misunderstand the problem?
They think that providing care for detransitioners is a conservative issue. And so it's a political thing. We just need care. That's what it comes down to is that we need care. I know detransitioner. It, I, I know detransitioner. It took him 2 years to get his implants removed, his breast implants. And what's difficult is that it's not simple as you just detransition, right? So if you are a biological male, you transition to a woman, you detransition, um, you might have to have your implants removed because if not, then, and especially if you do all these other surgeries like facial feminization, then you might have to continue living as a woman, even though you're no longer a woman, you've detransitioned. So for some detransitioners, they actually can't detransition. And that's an issue because you're not going to get the care you need. And you're going to be dismissed by doctors. Um, on the most part, like there's always going to be exceptions. There's always going to be people who are compassionate. But we are seeing this pattern with detransitioners that they're being dismissed. Um, too, I imagine it's a hard thing for doctors to actually and surgeons to actually come to terms with the fact that, yeah, I did make a mistake. Like I misdiagnosed this patient and I performed the wrong surgery on them. And then also there's the lawsuit part. So it doesn't look good for them. And so I think that it's making them uncomfortable that they've made a mistake.
Now, the thing that's confusing to me is that, I understand why the patients who arrive at the doctor's office, whether it's a therapist or a surgeon, in distress. I mean, they're there because they're in distress, and it's a kind of mental distress, emotional distress, as much as physical, and in fact, especially if they haven't been diagnosed with a physical ailment. And I'm amazed that the doctors, the medical professionals, aren't as hesitant about things like lawsuit and making a mistake and malpractice and misdiagnosis and all the things before they do these drastic permanent things to people that they might regret, but they are after. Like, it's astounding to me. I mean, I understand that there's money associated. But what I think is hard, Camille, for people to wrap their minds around is that, we all get the self-preservation instinct. We all have it. But why that doesn't kick in advance? Like, th- how good does the money have to be? How good does your sense of whatever it is that you're getting out of doing these things without really thinking it through have to be that you go whole hog into it as a doctor? Like I said, my compassion for the patient is much greater because they're in distress. They're coming and saying, "Help me." And it's incumbent upon the medical professional to do no harm. But it sounds like they're mostly worried about not doing harm to themselves. And that's happening after the fact, not before. It's just baffling, absolutely baffling to me. Why would they wouldn't worry about I might hurt myself? Look, women go for cosmetic surgery. They get breast aug or breast reduction, they get tummy tucks, they get lipo, they get all kinds of things. And doctors, make them sign like they give you counseling, they make you go through all of these things before you get basic cosmetic surgery. They talk to you about regrets. They show you befores and afters if they're remotely responsible, but this is what they do. And I know this from personal experience. I've had a couple of surgeries that, after having kids, and I went through all of this, and the doctor was like, "All right, now I just want to make sure you know the risks, what could happen in this. It's major surgery. You understand what's going on, et cetera, and so forth." But that's cosmetic. They weren't removing anything. They weren't, I mean, they were putting me back together again because things like didn't hold together in my stomach. Having a 10-pound baby will do that to a person, but they were very clear. Are you sure? Are you really, really, really sure you want to do this? But to tell a young person who says, "And I'm in psychological distress," it's just, it's baffling to me. So, okay, after the fact, the detransitioner is there and they have all these sudden worries they didn't have before, and they just don't do anything. They dismiss it or they say, "We can't help you." Now, if you came cash in hand, would they be like, "Okay, sure, fine," or are they still worried that they don't want to validate that you changed your mind because other people might sue them?
I do know that detransitioners, there are some detransitioner women who, they have implants after having mastectomies. So the procedures do sometimes go through. It's just, there is some difficulty with it. And I think it's going to really depend on the surgeon and the doctor, like if you get care afterwards. Like I know, Prisha Mosley had issues getting medical care. Um, it just can be very difficult. It can just it just it's really going to depend on the practitioner, but making the billing or not having those billing codes does make it a lot more difficult.
When the patient goes for their transition procedures, whatever procedures they're electing, do they currently, to your knowledge, have any conversation prior to that about what the process would be bare minimum? Obviously, they can't predict for each patient exactly what it would be for detransitioning, but is there any conversation about detransition when they go in for, let's say, a mastectomy or any kind of other procedure? Like, okay, so before you consent, part of the informed part is I need to inform you of what it would look like if you changed your mind. Do they do that at all?
They do not talk about detransition.
That
Um,
just seems grossly irresponsible.
right. Well, and it's weird. It's like I never heard of the word detransition before detransitioning. It was surreal. And then I actually started. I think I saw. Let's see here. I think I saw the first time I was introduced to the idea. I think was on Blair White's channel,
Mhm.
or I saw a detransitioner, but that's it. Like it wasn't. I wasn't introduced to it before the idea, and then two, the problem is as well is that they don't. Let's see here. So they're not introducing people to the idea of transition.
Well, because when they sell it, or I should say, sell the acceptance of it. So I've seen videos of there's I believe a woman, I think she's a doctor out in San Francisco somewhere who was on record. I've seen the video saying, if you want breasts later, you can go get them. Like, just flippantly, if you change your mind and you want breasts, you can go get them. It's not that big a deal. Like, making it like it's not that big a deal. And it's a huge deal. I mean, it's an enormous deal. And aside from the function of the breast, okay, there's just what goes into getting implants. They go under your muscle. You need a certain amount of skin to cover an implant. You need, do you want nipples? Like, they're all the things to go into it. And to so flippantly go, you can get them later without explaining to the patient. And that would look like this.
Yeah.
And it may or may not be possible because
Yeah.
reasons. That seems to me informed consent doesn't exist without all the information.
Yeah. True informed consent is not. This is not true informed consent. Like, I was not too, like, they need to be honest about like what's going to happen if you decide to detransition, like, and that's what we did. We described that young man who reached out to us. We said, okay, if you want to remove your testes, here's what you're going to have to consider. Like, here's all of the health issues you can potentially get, and then you have to look into banking your sperm, and you have to think about the cost of that too, because it's going to cost monthly to do that. There's also the initial cost of that. So there are things that, because I wish that I had that information. Like, nobody said to me, okay, you're looking into this. You might not be able to breastfeed, and here are the issues that may come with that and the extra costs that may come with that. And if you consider implants, if you get implants, well, you might not actually respond well to them. So you might not be able to get implants in general, because there are issues. Sometimes women get implants and then they have a bad reaction to that, and then they're not
Mhm,
able to have implants. So you might not be
mhm,
a good candidate for that. And then I've
mhm.
heard of like fat redistribution, but from my understanding too, is that your body can absorb the fat. And so
Exactly right.
that's an issue too. And then it's like, well, is that going to be uneven? And so that's actually the one I'm considering, because I don't want implants. And so it's they're not giving true informed consent, and they're not giving alternatives. And that's a huge issue. Like, they're not saying, okay, you want to do this transition, you want to physically transition due to gender dysphoria. Here are some options for that. I think part of that too is that there's some of these individuals do mean well. They're thinking that this is like being gay. Like, I've had a couple of people say that to me, like actually two different therapists say, well, you must be non-binary because we used to think being gay was a form of mental illness. The problem is that being gay doesn't require medicalization.
Mm-mm.
It doesn't. So being trans mostly does. Um,
You know, there are people who are saying, and I'm kind of rapidly becoming one. I make myself very unpopular here because I know people who are trans, so say they're transsexual, and I like them very much and so on. But I'm starting to be very skeptical that there is such a thing. In other words, I think people's feelings are very real. Like, they feel a certain way, a massive amount of discomfort that they associate with their sex. And yet everything I'm learning about how medicine is failing these people who arrive and say, I am so uncomfortable in my own skin that I literally I am attaching it to my sex. And rather than just wear a costume, in other words, rather than, cut my hair off and wear men's clothes or grow my hair long and wear makeup, rather than just cross dressing and living my life appearing like the opposite sex for all intents and purposes, but continuing to be this just so that the outside world responds to me differently. No, I want to down as close to my cellular level as possible change. um I can't help but feel like the medical establishment has, and political ideologues have created this thing that actually isn't. In other words, that there's not someone who's just born trans, if that makes sense. And that what we have people who have varying degrees of different other disturbances going on that are real, very, very real, and deserve to be treated. Um, and heard and all the things, and not, and maybe no two people get the same treatment. It could be a variety of factors feeding in, but there's a, we're going to skip the 50 things we could look at that might be causing this level of discomfort, go straight to the one that has a political and ideological component to it, and that is the most extreme in terms of the medical treatment, not to mention the most expensive, and from which there's really no backing out, right? And I'm just rapidly coming to the conclusion that that something has been invented.
Yeah, what concerns me is that they're not looking into alternatives because this is so ideologically possessed.
Wow.
And then also just in general, the long-term impacts of putting HRT into a body that was never meant to receive it. And also the complications from these medical procedures. I mean, it's scary because I know when I detransitioned, I thought I was one of the only ones, only to find out um, much later that there's so many others out there like me. And there's it's surreal to me what's going on, like all the complications, like hearing about fecal matter, like going out of, from my understanding, it was like the neo vagina or something. Like there's something wrong, like because they're having, well,
They're using colon, parts of
they're
the
using
colon.
colon. I mean, it's just like it's very Frankenstein. It's
Yeah.
very
Well, it's experimental. There's
it's
not a
so
protocol that's had a
yeah.
long enough period of time of working, and they're experimenting on living human beings. They're experimenting in real time on real human beings, not telling them that they're experimenting. They're acting like they know exactly what they're doing. This is how we do it now, but what they're not telling you is, for now, so far, this is what we've come up with to fashion this part that you weren't born with. And all the while, what's so concerning to me is that at the start, when you affirm, yes, you are a woman, or yes, you are a man, or yes, you're a non-binary, when you just affirm it like it's true, it's real, whatever, anything said after that is not going to be part of informed consent, because you've already told them that this belief that they have is true. It's not like, well, if that's what you would like to be, we can help you look like that with this experimental procedure if you want. It's not positioned like you're part of this experiment willingly. It's saying, we're going to just make it so that the outside world, like, sees what we already accept as reality. There's no other new piece of information there, because imagine they came to you and said, well, these horrible things could occur, right? And you could be in excruciating pain and have all these problems, but you are a man or you are a woman. Like, that kind of contradicts. How can it be true, but then these horrible things could occur, that I'm not meant to be this? So I just feel like the affirmation, the politicization of this condition, of this situation, or this set of conditions, is preventing doctors from being able to practice good medicine. And they're not victims. They should be sticking up for themselves. It's very, very cowardly as supposed healers that we don't see, especially after last week with the WPATH files. And I wanted to ask you about that too. That we don't see physicians ringing your phone off the hook. Like, how can I help? You know, or do you have people who are reaching out and saying, I want to help. I want to be part of this to help detransitioners.
Um, we don't. I remember reaching out, or because I run Detrans Help, and we talked to a lawyer, and he said that the money was more in the lawsuits than they are for detransitioner care. So even within the nonprofit space, there's a lot of people who care about us, but the money. I mean, GenSpec's doing great work with therapy, but we don't have the doctors. It's very difficult to get doctors to even get on board with this. It's so political, and they're looking out for themselves. And two, it's a whole new thing to learn. It's not just like, well, I don't know. It's not like the procedures they're currently working with or we're trained in. It's that you're learning a whole new issue, and how to treat a patient. This is a particular patient and demographic that has all these particular issues and they need to be treated differently than the trans population. It's the learning curve. So there's that issue. Um, but I mean, I still have health issues, and I know Detrans Help wants to look into non-invasive alternatives for detransitioner care. Um, but getting funding for that has been difficult. I mean, just in general, doing a case study is difficult because in but it's important because once you get the case studies done and you get those published, once you have it published in a medical journal, then you can take that publication, take it to your insurance, and get these treatments covered by insurance, which is what we really need right now. Um, yeah, it just like the whole WPATH thing was it was sad, but I'm not surprised. I know Detrans Help actually reached out to WPATH and we said, we are concerned about the patterns we are seeing in detransition. Um, we are concerned about things like internalized homophobia because you have um, gay and lesbian individuals who they would rather be straight than gay, and so they transition because of that. Um, we told them that concerns and I mean there are other ones too. There's like, there's all these comorbidities that we're seeing in the detransition population. We are seeing trauma around sexual violence is also a commonality with detransitioners, and that sort of escapism and trying to protect yourself. These are all patterns we're seeing in detransition. But anyway, we did reach out to WPATH, and we're just trying to start a discussion. We'd like to start a dialogue. Are you open to this? And we never heard anything back. So we tried to start that discussion because I mean, in their standard of care 8, they're very open about the fact that they don't know much about detransition. You can look it up. It just pretty much says that transition is because detransition is because of social pressure and pretty much transphobia. Like that's their argument. Um, but as we know, and why we wanted to start a discussion is because we have all these other things that are causing people to want to transition.
Well, and I would think that if you transition and you not only have complications, which it sounds like, and maybe you can help educate us about the likelihood or percentage of complications from minor to major, but it doesn't fix it. Like, in other words, whatever you felt before, if you're still feeling discomfort, maybe it's shifted, it's a little different form or whatever. But if you're still depressed, like it didn't fix the depression or it didn't fix whatever was going on, that's got to be devastating because you go through all this assuming you come out the other side, and people talk about euphoria, but then if that wears off, for example, and you're like, well, wherever I go, there I am. um that's a whole new feeling, because before, I don't feel comfortable in my own skin, but there's this thing I can go do. I can look forward to it. I can, set a date. I can do all these things. And then, so you feel like there's light at the end of the tunnel. You go on the other side, it's like, okay, not only didn't it fix it, now I have regret too, and pain. And what you're told is that's in your head too. You're just responding to social pressure. I can't imagine. Like,
Yeah,
it's right now, Camille, I'm sorry, I have to tell you, listening to this, like I'm resisting the urge to scream. Like, I'm resisting. This, maybe it's because I'm a mom. I don't know what it is, but this makes me so mad. Like, I'm trying to imagine being the kind of person who can have somebody sitting there in their office who's in very obvious psychological distress and can put them through this kind of a ringer, knowing they really don't know what they're doing. It's impossible for me to conceive of it. It just is. So I'm sorry. But as far as those complications are, what would you say is like, I mean, you might be guessing, maybe you have statistics. Is it like 75%, 80 to 50%, 20? I mean, what are we looking at here?
I don't have statistics, and that's the thing we also tell detransitioners through Detrans Help is that we don't know. We don't know what long-term impacts are. It's just like it just varies depending, like, on some surgeries go okay, some surgeries don't. And some men who've had you know body parts removed. Um, they respond to testosterone. Some have a really hard time taking testosterone afterwards. So the reality is, and I want to say that up front, is that we actually don't know. Like Prisha Mosley um, went on birth control and then she got pregnant. And there's all these people telling her, you can't get pregnant. Well, she got pregnant. And so then it's just like, you have to be careful because you could accidentally get pregnant. That's something detransitioners need to know. It concerns me because there's so much going around saying like this is definitely what's going on. Like you're definitely going to have this issue, and then we find out like we don't. And that's the scary thing is that there's not the research on this. There's not the research saying, okay, we definitely know when you detransition, here's what your issues are going to be. Here's your path of treatment. We don't know this. Um, some of the complications we are seeing is nerve pain. This is this is one that I was surprised about. Like I've had it personally after the mastectomy, um, and we are seeing this. We don't quite know why it is. We don't know if there's a possibility with is it just from the top surgeries or is it from something else like bottom surgery? Can HRT cause this? We don't know because too, just like we have detransitioners who've done some procedures but not all of them. It's very like pick and choose, and so we just don't know. Um, Osteoporosis for men, like this is detransitioner men, like we are seeing this as an issue. Vagina atrophy is a big one. Like we are seeing this for women who've detransitioned, and even like trans men, like vagina atrophy is an issue. So urinary issues can be a big one for men who've had bottom surgery. But yeah, at the end of the day, we don't know what all the patterns are because too, like you're putting HRT into a body that was never meant to receive it. We don't know all the systems in the body, but that's impacted by, um, you know, um, I mean, Buck Angel was talking about his. We were talking like after his podcast, and his teeth were cracking. I'm just like I'm thinking to myself, is that from like that? It's messed up other parts of his system, and so that's why he's having this issue. We just don't know because we just don't have. We just don't know.
Yeah. It seems like that's a pretty big problem. And there are a lot of areas of medicine where they just don't know. I mean, there are a lot of things they don't know about cancer treatment, a lot of things they don't know. But this seems to be the one area of medicine because of the political component where the doctors are not being straightforward with the patients. The patients are 201 every single case. It's not like some are there because they have psychological distress. So it's not, we're not talking about a small percentage of people who also have psychological distress on top of this medical thing that's wrong with them. They are seeking medical treatment for something that's essentially a psychological issue. There's nothing literally wrong with their penis or their breasts, right? And so it's like we're going to blow right by that. We're not going to treat it. We're not addressing it. This is the solution. The medical treatment is the solution. The hormones, the surgeries, the affirmation and love for this new identity and all of this, that's going to fix you right up and you're going to feel better. And worst of all, we let you self-diagnose. So in other words, we're not even acting as doctors. We're acting as like mechanics. Where you imagine if you did it with your car, if you showed up with your car and you said, I don't know, it's just the car's not driving as smoothly as I would like. I need a new transmission. And the doctors went, yes, you do. You need a new transmission in your vehicle. That's why it's not driving as smoothly as you would hope it would drive. Let's replace your transmission. And obviously, I'm going to hurt you personally, but like, so they go and $3,000, $4,000, $5,000 later, you got a new transmission and you're driving down the road. You're like, it's worse now than it was before, or it's the same. And they're like, I don't know. Well, tell me, what should I do next? Like the mechanic's going, tell me, like, wait, you're the mechanic. And instead of going, well, are you sure it's a transmission? Like maybe we should look, it could be something else. It could be your tires are off balance. And I hate to use this horrible analogy, but I'm purposely going with the absurd because I feel like the doctors are not acting as healers, they're acting as mechanics. And they're treating the body not just as a mechanical device to convey identity, as if that's the key to mental health, but that they're treating it as a unisystem. When, as you've pointed out, it's an extraordinarily complex, interconnected series of systems.
Yeah. Yeah, it's like it's scary too because I'm worried about these conversion therapy laws. Like I know Oregon thankfully did not pass it, but in Canada they've passed it, and were talking with a naturopath, and he thinks he can actually prevent transition. He thinks that it's very similar to anorexia, but he can't look into it because the conversion therapy law in Canada has I believe it's a 250 $100,000 fine up to, and up to a 5-year prison sentence. And so for him, the risk is too great. And the thing is, like, that was just to treat detransitioners. That wasn't even to investigate why somebody's experiencing gender dysphoria. To even treat detransitioners, he wouldn't do it because he was too concerned with the risk. And that's the thing we have to remember about these conversion therapy laws is that because of and there's a reason why there was the conversion therapy laws, like trying to prevent it, because um, what was done to gay people and lesbians was horrific and messed up. Like
Of
that's
course.
it was not okay. Like
Of
the
course.
physical abuse was not okay.
No, no question.
Exploring gender is very different from that, and it's again it's that sort of conflation between the two when they're not the same thing. The medicalization makes being trans very different, and the risks and health consequences of transitioning are very different from being gay.
Well, and gender dysphoria slash body dysmorphia or the combination thereof has nothing to do with sexuality unless one of the causal factors is internalized homophobia. Then I suppose it has something to do with sexuality. But other than that, it really doesn't. It's not people have, that's what they go LGBTQ. But it's like you're smashing things together that don't go together. And I've spoken to several people who are very frustrated with that because the activism on the T side is beating up a lot on the L and G and even the B side. And the Q is just it is this is so complicated. And I think leaving all of that aside, it sounds to me like your major goal is just to help the people who either have already been through it and they're seeking help just to get on with their lives, like, to get healthy and get on with their lives and be okay with themselves, or to stop them from making a mistake, make sure they really are informed. And that's the goal with your organization, correct?
Yeah, I would say that in particular, we do focus on detransitioners, partially because we see such a lack of care for detransitioners, and we are concerned about the further medicalization of detransitioners. Like I know some detransitioners are going to have to be on HRT for the rest of their lives, like if they've had their testes or ovaries removed. So there is that. Um, but if we don't have to have detransitioners, take medications, then that would be preferable. So I know one detransitioner who has nerve pain. And the first thing they want to do with her is give her gabapentin.
Oh, that stuff is horrible.
Yeah, and so that's what they want to do to have her feel better.
Nightmares from hell for a lot of people. It's a terrible side effect of that drug.
Yeah, and so that's like the first thing they say to her, "We want to put you on gabapentin." And thankfully, they didn't put her on gabapentin. But what's frustrating to me is that I've struggled with nerve pain in the past. I've done a treatment called PDTR, which is a manual therapy. I can't remember the exact acronym. It's like perceptive tendon reflex or something. Like it's a manual therapy, And like within like one session, I come with well, I've had a lot of health issues. So I've come with these different issues, and within one session, most of those issues would be resolved. So we could do something like PDTR or other forms of manual therapy, and then we can address the issues in a non-invasive way that's
Mhm.
low risk. And the patient feels better and they don't have to be on a medication for the rest of their lives.
But
Like,
these aren't even covered for me. You know what I
yeah,
mean? Like, if I wanna go for certain kinds of treatments for nerve pain, I know this again because I had spinal surgery. That's how I know about gabapentin. I had nerve pain. They put me on it, and it was a nightmare. I decided to take the nerve pain rather than the gabapentin because that's how bad the side effects were, and I tried to go for different kinds of manual therapy. You know, even the physical therapy was only covered up to a certain point. So when you talk about insurance coverage, this is a very serious issue that if the way we get our health care is through insurance, which it is. I mean, I don't like it. I wish we could do self-pay everything. It would be a lot cheaper, but we have an insurance structure in this country and it's pretty much mandatory at this point. But then they also get to choose what they pick, what they cover, and they'll cover drugs and they'll cover certain things this much. And if it doesn't work for you or it makes things worse, oh well, too bad, so sad. We're not paying for acupuncture, we're not paying for massage, we're not paying for whatever, even in therapy. Oh, you're getting EMDR? No, you can't have that. It's like, wait, so I can go for this kind of therapy, but not that kind of therapy. They're not the doctor, least of all your doctor, but they're saying, and that's for all of us. Now imagine the person is a detransitioner.
yeah, yeah. It's frustrating, and I do know like I've been very grateful that in Oregon, like as much as Oregon is messed up, I've been able to get acupuncture, and that's really helped me too. There's
Yeah.
even I would even say something like neuroacupuncture would be more efficient than acupuncture by itself. Um, but in general, that there's a possibility that these studies could expand past detransitioners as well and get these treatments covered for more health issues because it's sad to me. Like I went through hyperbaric oxygen therapy, which isn't covered for mental health, but it's remarkable. So you look at something like hyperbaric oxygen therapy, and if you have if you're diabetic and you're about to lose a limb, you could go through hyperbaric oxygen therapy and save that limb. If you have sudden hearing loss, sometimes you can do hyperbaric oxygen therapy and reverse the sudden hearing loss. Um, there's it's a remarkable treatment. There's differences between hard chambers and soft chambers. Um, there might be even potentially patients because there's not a lot of studies on the soft chambers. There might even be patients because not everybody can do hyperbaric oxygen therapy. There might be certain patients who respond better to the soft chamber because it's not
I
as
don't even know what
pressurized.
it is. I don't even know what it
Oh yeah.
is. I've never even heard
So
of it.
sorry about that. So
No, that's
pretty much,
okay.
yeah. Hyperbaric oxygen therapy is where you receive pure oxygen in a pressurized environment. So it's like you see sometimes like they're like a tube, like glass
Yeah.
tube or whatnot, and then you're in the chamber. You have a simple mask, and you're getting pure oxygen through that. Sometimes you'll see like a big room with a bunch of people in it. It's again pressurized, and you're receiving
Mm.
that oxygen. Um, in a soft chamber, it kind of like blows up, and then or like not blows up, but it inflates, I should say, more so. So it
Alright.
inflates, it's pressurized, and then you receive pure oxygen. So the only difference between a hard chamber and soft chamber is really the soft chamber is not as pressurized as the hard
Right.
chamber is. So, but it's a remarkable treatment. There's just so much we don't know about it. But I was a part of a case study for that, and we went. I at the beginning because I was marking it every single day. I went from I we did it for ADHD and anxiety. My anxiety went from like what was it? I think it was 26 to 6. So it dropped significantly. And then my ADHD went from 72 points after 60 treatments. Um, let's see here. What did I say? 62? But yeah, so pretty much it went from like 62 to like
Right.
7
Right.
at the end of it. So my ADHD improved significantly after doing HBOT treatment, or hyperbaric oxygen therapy. So the treatment's remarkable. It's done so much for me. Um, and the thing is, too, is it's one of those treatments that just does what it needs to be done. So I
Yep.
was thinking that it was going to help with some of my physical health issues. And again, like the thing I noticed was that it ended up helping the mental health issues before addressing some of those physical health issues. Um,
Yeah, and it's hard to know anymore, like, which comes first, the chicken or the egg? Like, it is my mental state causing me to degrade physically? Is my physical state causing me to degrade mentally? And after a point, does it even matter? There are people who understand that you're a whole body with lots of different interconnected, interdependent systems. And then there are people who go, well, I'm a specialist at this and I'm a specialist at that. And they treat you like you're parts, like you're just cuts of meat. And when the mind is involved and they can go to either a chemical or mechanical treatment, that is what medicine tends to do. Here's a pill, here's a surgery. And if they can do both, here you go. Here's both. What is the pushback, if any, from the insurance companies on the gender medicine people, because they are pushing expensive surgery? I mean, these are not inexpensive procedures. Not to mention, we talk all the time about the motivation is money, the motivation is money. Well, it's certainly money on the part of the practitioners and the pharmaceutical companies. We get that. But if I'm an insurance company and I see a political movement pushing to be like, you have to pay for this because otherwise you're a horrible bigot, right? And now that you're looking at could be 20, 30 years of I got to pay for hormones, I got to pay for pain medications, I've got to pay for visits to get all kinds of problems, more surgeries, etc. Um, that's going to be massively expensive for the insurance company. Are they pushing back at all? Or are they just like, yeah, it's fine?
I think that they're going to start pushing back. Um, I don't think it's happening yet. I know there's a lot of, I mean, too, what makes it difficult is that there is no detransition. Like I said, there's no like ICD-10 code for detransition or any medical code. There's like another medical code out there, but what I've seen is like the gender variance and stuff goes under the ICD-10 code, which would be there would have to be detransition with that as well, which makes it difficult because the World Health Organization is the one that creates and manages the ICD-10 codes. So we'd have to get the World Health
Ah,
Organization. Um,
also
I
a
don't know
political
because it's
organization.
oh, what's that?
Also a political organization that
Yeah.
has made it fairly clear where they stand on gender inclusion, which basically, if they've resolved that detransitioners are doing it because of social pressure and transphobia, then it's going to be an uphill climb to say, no, we want to take care of the detransitioners. Um, but I still the costs, if they were successful, for example, in medically transitioning every person who indicates that they are from non-binary to trans, um, the cost would be astronomical. And it's especially if you consider not just the care all those years, but how many will want to have children and maybe do go through the, are they going to fight to get, you got to pay for storing my sperm or storing my eggs. And now I need IVF or I need a surrogate and I'm a protected class. So I need that covered or I need it. I mean, where does it end? Where you tell people you can do this and you won't be treated any differently than somebody else. So how do you tell that couple, for example, we're not going to cover your IVF treatment because you chose to sterilize yourself or have your body changed. But the natal female and natal male, we're going to cover IVF. And we're going to end up in these kind of arguments. And the whole thing seems like a minefield.
Yeah, it's the I mean, it's going to be expensive for insurance to cover it. Um, there's something else I was going to say, but it was yeah, because I mean, it's like that young man. It just oh yeah, that was it. So that young man who reached out to us, I
Yeah.
was talking to him about making a sperm and the cost of that. Like you have to consider
Yeah.
that, um, and he's coming from this is like, and he said to us, like, he's like, that sounds fine to me. Like, I don't like sex, so that sounds fine to me. And it's like when you're in that mental state of like you're really struggling, you're depressed, and you're trying to get through the day, the last thing you're thinking about is having kids in the future. Like you're just trying to survive. And
Well,
that's
you're also not thinking of your future potential partner.
right.
And I've already noticed this, that therapists who affirm immediately are not telling their patients that if they move forward with this course of action, they're reducing their dating pool by about 98%,
Yeah.
99% really. And
Yeah.
I'm being generous.
Yeah. And the frustrating thing is that they're also telling them, like, oh, well, you'll find somebody who loves you for who you are.
Mm,
And it's like you are limiting your dating pool. Like I personally experienced it. Like that's something to actually consider. It's not just, oh, well, you'll find somebody who loves you for who you are. I mean, yeah, detransitioners do find love, and have had successful relationships and have kids and families, but you are limiting your dating pool. Like that's just a reality.
well, let's face it, people who don't go through all of this are having trouble dating. Like,
Mhm.
it's all over, the news and everything, that the sort of the world of dating has changed so dramatically that people are struggling to make connections, or struggling to find people they're compatible with. They're struggling to keep relationships going, whether it's because of the internet and porn and all kinds of different things, that people report that they're like, "Forget it, I'll just be single," and they're not happy with that, but the dating situation is really unpleasant. Now imagine that plus you have medical problems. Like, you're going to somebody and saying, "You should know I have this complication and I have to take these medications and there's this pain that I have." I mean, people aren't being cruel or nasty when they say, like, "I don't know if I can," like I said, but you could be dating somebody who never went through transition. They're just telling you, "I'm going through cancer treatment," or "I have, diabetes that is, I might lose my leg," or so, and that's a tough thing to have a conversation about when you're dating.
Yeah.
So this makes it exponentially harder. And I just don't think that long-term planning, first of all, is a weakness for people who are ADD, people who are on the spectrum, people who are under the age of 26. I mean, you start ticking the boxes of where planning ahead and all that is already a challenge. Best case scenario is a challenge. Now add trauma, body dysmorphia, and I'm absolutely in shock at how many medical professionals have just, excuse the expression, shot the bed. Like, they just have completely ignored all of that. I'm not a doctor and I know these things. These are common sense things.
Yeah, the most harmful one I think is this idea of like, well, you'll just find somebody who accepts you as who you are. Because I know I've been told that. It's it's and it is really hard. It's hard broaching that subject. It's like how do you broach it? What date do you broach it on? It's not like you can't find anybody, but it makes it significantly more difficult.
Well, no one should make promises to you that they can't keep. Meaning, like, anybody who says you will find someone, or that's just, again, irresponsible. It would be better, it'd be more responsible for a therapist or a doctor to say, "Well, let's talk about that. Let's talk about how that might add some difficulty to conversations in the future. How would you feel about your decision if it turned out that you were not able to find somebody to spend your life with? Would that significantly negatively impact your quality of life?" And let the person make the decision. I mean, not, "Oh, you'll find someone." That's a sales pitch. That's not therapy. Therapy is like, "Okay, as we're on the topic, what do you think about that? How would that impact you? Worst case scenario, you don't meet anybody." I mean, I've met straight heterosexual people who delay dating, marriage, et cetera, and so forth. And they'll tell you in their late 30s or 40s, I wish someone would have told me. I wish someone would have discussed it with me that, how am I going to feel if I'm infertile at 40 or whatever? And they've been to therapy. And that's them. Now imagine all the other changes on top of it. I just am starting to think that we in general as a society need to completely reframe how we think about caring for people, like the helping professions,
Yeah,
medicine, all of it.
and I do like, and I get worried because I look at the whole, like everything going on, and I think back to medicine and how like we're seeing chronic health issues rise, we're seeing mental health issues rise, seeing obesity rise, and I was just, and then the fact that something like the physical health thing is just not taken seriously. It's just like my experience was, okay, here's an antidepressant, here's ADHD medication, and if you don't respond well to that, then they just throw their hands up and they don't know what to do. And I just think of and I hope that things start changing. There Chris Palmer MD was on the Today Show, and he was talking about like in a patient, one of his patients was on there too. So his patient has bipolar. He's been successfully able to manage it through a ketogenic diet.
Mm-hmm.
So now he just takes like a very, very mild medication, and his goal is to get off of it. But he wasn't functional. Um, and it's scaring me how much we're not looking into these alternatives, and how as a society we're impacted. Like I know many of us are concerned about, like, I know, like, personally, I'm concerned to go out, and because it is so political. Like, it
Mm-hmm.
just, like, I've had those interactions, just, it's not, people are just so dysfunctional, and it's not just like, well, I can take care of myself. It's like, as a society, you're dealing with a whole bunch of dysfunctional people
Right, right,
because we're not able to properly treat their issues.
right.
How we eat now is very different from 100 years ago. Like, we've added so much filler and artificial ingredients to our
Mm-hmm.
food, and that's like, that there's the environment, there's the microplastics, there's the other toxins, forever chemicals. It's just like how much of that is impacting what we're seeing right now. And then you're struggling mentally, and you're given this answer of, well, it's because of transphobia that you're miserable. It's because of sexism. It's because of, like, there's an answer. Like, people are searching for an answer, and
It's starting to feel almost medieval, Camille. I'm not gonna lie. It feels medieval. Like I feel like there's a plague, and rather than realizing it's the fleas, and they're biting you and they're carrying it off the rats, and like this very thing, it's like it's demons. It's Satan. Is it they're giving you things that are intangible, subjective things. Transphobia. It's bigotry. It's social pressure, which is weird because flip it around, and those of us who are saying, you know, what's happening to the person who is manifesting physical symptoms is social pressure is pushing them towards this, but we can actually quantify it. We can say this person spent 8 hours on the internet, they went to these websites, they had an interaction with these 5 people who told them these things. So we can actually follow the path to see how it happened. We're not just making it up, but they're inventing a force. Transphobia is causing you to be uncomfortable. Why didn't you guys invent the force before the person had the surgery? Why is the force a positive until we do things to you? It's your gender soul is in the wrong body. But then after we do the stuff to you, what? There's something very weirdly mystical and medieval about it all. There's not a lot of reliance on science, facts, reality, empiricism. Like, wait, before we go whole hog, let's test out this thing first. No. And I'm starting to feel like they really very much are almost like witch doctors. I watched a show the other night on, I don't know what channel it was streaming. I think it was Prime. It was called Royal Autopsy. But they talked about Queen Elizabeth the First and Charles the Second or something. And just going back trying to figure out what was their actual cause of death. In one case, they said it was They weren't really sure, maybe apoplexy, which is stroke. But they had 6 or 7 days documented of all these weird symptoms. And then with Queen Elizabeth I, they said it was like malaise, and she died of ill tempers, or something like that, ill humors. And we know they bled people. What we find out going through this medical process today using actual empirical evidence is that these people, unfortunately, were going to die anyway within probably the same amount of time that they died. The only difference is they spent their last week of life being tortured, absolutely tortured, like George Washington, who was bled to death basically for having a cold. And I'm starting to feel like this is what's happening with people who have these certain kinds of, where there's mental illness or they physically don't feel right in their own body and I just don't, whatever. And then like, let's try this, let's try that, let's try the other. It's the modern day bleeding, modern day leeches. And I'm hoping that with the release of the WPATH files, more and more people will start asking these questions. But the last question I have for you is, how can the rest of us help? Like when I say the rest of us, like people not going through what you're going through, who care and who are angry and want to do something truly helpful. Like, that's not just going on the internet and banging away on our keyboard and being angry about it, but is there something that we can do? I know I'm sure there's money that could be donated someplace, but are there other messages? Are there letters to specific people we need to write? Like, what can we do?
That's a good question. There's a lot. I think that from what I'm seeing, the lawsuits we have good support around that. I mean, it was kind of difficult to find somebody in Oregon because I have my own lawsuit um, against the two mental health professionals who approved my surgery. I mean, definitely the medical side of things. If there are doctors, particularly naturopaths or functional medicine doctors, if they want to reach out to me, that would be really helpful. So we can kind of, because we need to, like, what we need case studies, we need to have these published so that we can figure out like what patterns are there. I mean, that's a big thing. Like, what patterns are there actually in the detransition community? How do we treat those patterns? And hopefully in a way that's non-invasive and not further medicalizing detransitioners and not further harming us. Like that's ideal. So those are the big things. I mean, things like being able to, like, detransitioners need each other, and we are all over the place. Like, there's not, the problem is that, like, it would be nice to do things like retreats for detransitioners to allow them to actually heal, because that's one of the big things detransitioners need, is just to connect to one another and to know, like, we're not alone in this. Um, so getting funding for something like that, because again, we're all over the place, and sometimes it can be, a lot of detransitioners don't feel safe connecting with each other in certain areas. Like, I know I was talking with a detransitioner in Portland, and she didn't want to meet up because she was concerned about safety. Um, but yeah, the medical, I think the medical one is big, and then being able to provide a space for community for detransitioners, I think is going to be a big one too.
Right. And maybe even
Um,
like a group of therapists who uh are comfortable, specifically working with detransitioners in the sense that, because it's a risk to their profession as far as they get ostracized. They're told the APA is like all in on the gender medicine side, but not the detransition side. And it's a new trauma, isn't it? So if you came into transition because of trauma, hoping this would fix it, not realizing that that's what was going on, and then you come out the other side and you want to detransition, you've got a whole new, the first one is still there. Plus now you have a whole new set. The trust has got to be almost non-existent. As probably is gone, negative trust as far as people you seek out to help you. And then of course the big one is trusting yourself is probably hard because you made the decision.
yeah, and it is difficult because detransitioners generally don't trust therapists or doctors. I know, even like if we do need something, it can be difficult too. Like, I know, like, for getting reconstruction
Mhm.
surgery, I need a letter because it's going to be billed under gender affirming care. And the therapists don't feel comfortable writing the letter because they're not doctors. They're like, well, like the ones that are on, who are savvy to this and like realize what detransition is and that's an issue, and they think we deserve these surgeries, like to be able to kind of get our lives back
Sure.
as much as possible. But then they're like, well, ethically, I don't feel comfortable writing this letter, and so
Because
that's
it's not
another thing.
gender affirming care.
Yeah.
Yeah, that's gotta change. I mean, that just seems like right out of the gate, they've got it, but if that's at the World Health Organization, those codes?
The World Health Organization has the ICD-10 codes. Yes.
So
Um,
why is the United States insurance industry going by the World Health Organization codes? Period. Never mind on this issue.
I don't quite know because there's 2 billing codes, and one of them tends to be more generic. I know Carrie Mendoza was working on that, but one of them I think is more generic, like mastectomies and such. So she was trying to get it done through that way. But when you actually look at the um, the billing code for transition, it's coming out of the WHO, and I don't know why that is. I didn't see any under the American billing codes. So yeah, I mean that's the other thing is like getting the WHO to create something, if not the American billing code system.
Right.
And I don't know how to put pressure on WPATH. Like I said, Detrans helped try to reach out to them, and
Yeah.
um, we never heard back. And the thing was is that originally they were going to be more strict and more selective, and then that wasn't enough for them, and so they actually changed their because there was somebody in Oregon and she's saying like this will eventually hurt trans people. And so she actually wrote stricter guidelines into WPATH. And then they decided that that wasn't, I don't know, that was like too conservative. And so they went, they went away with her restrictions. So WPATH is going to be a big one too. I mean, the WPATH files, there's just so much wrong with that. Yeah.
Yeah. Well, Camille, I applaud your efforts to do this. I mean, it's got to be, hard. You're going through your own thing and then you're trying to do something, start an organization. So I will make sure that everybody has all of your information down below in the description box. And, please make sure that we can, if people want to send donations, if they want to provide legal help, if there are doctors out there who want to provide some guidance or anything, or know of people who do, please get in touch with Camille, because I, I think this is going to be one of those situations where the pushback has to come from all sides. We have to change the incentives. We have to change that what is available to help people heal, like you said, and recover, so that detransitioners have that you can get your voice out. If there's one thing that I know about going through something that's really, really unpleasant, is that the drive to protect other people is very real. I think most people have some degree of that. Now, not everybody's comfortable putting their face and their name on it, but there's sort of a drive of like, I really don't want anyone else to have to go through what I went through. And so I think that's part of healing too. Like part of making it have a purpose, part of having it be like, okay, for this to not be all negative, I want to make sure somebody else is protected. Um, I think is really part of healing. And certainly anything that I can do moving forward, with what meager means I've got, I'm happy to help broadcast information or whatever. But this is appalling. And like I said, I applaud your efforts and I wish you the very best of luck on, getting somewhere with this. And to the audience, please spread the word. Share this broadcast. Um, I know, tell people it's an hour and 40 minutes or so, but can you spare an hour and 40 minutes to really learn what's going on? I hope so. Your knowledge gained here from Camille might actually help protect somebody else from that. Is there anything else you want to say in conclusion?
Yeah, I guess just, yeah, thank you for having me. And allowing me to share my story, and then also to bring awareness to the issue, how complicated it is, because I think that um, it's just there's so much people don't know, and there's so much in general we don't know long term how this is going to impact us, and we do need help because there is going to be an onslaught of detransitioners in the next few years, and we don't have the medical care and support and just in general support to really support them. So yeah, thank you for listening and your support.
Yeah. Well, s- there's nothing else I can add. I feel like I want to go punch something. I'm not gonna lie. I'm pretty frustrated right now. But thank you to everybody for watching. Thank you for listening. As I said again, please like, share, subscribe to the channel. Go, follow up with Camille if you have anything you can offer, any ideas at all. Even if you know how to fundraise, if you know how to write copy, if you know how to write letters or anything. I mean, like I said, I think this is an all hands on deck kind of a situation right now. Especially in the wake of WPATH, we need to do everything we can to stop this from happening to anybody else. So thank you, everybody, and we'll see you next time. Thank you, Camille.